Hello, welcome. This is V Codemy, and I hope that all of you are doing good. So, this video pertains to surgery guidelines in the integumentary section 10,000 series. So, the CPT code range 10,000 series. As you can see in the picture, the skin is composed of different layers. The topmost layer is the epidermis, below it is the dermis. The epidermis is the outermost layer of the skin. The dermis lies beneath the epidermis. The bottom layer of the skin is the hypodermis, or otherwise known as the fatty layer. Below the skin is the musculoskeletal section. So that is made up of fascia, muscle, and underneath the muscle is the bone. So this fascia, muscle, and bone, the procedures done on these layers are in the musculoskeletal section in the surgery book. That is, the code range will be 20,000 series for the musculoskeletal section. So what are the different layers of the skin? So if you are a coder who comes across lots of procedures done on the integumentary section, you should know the different structures of the skin. Skin is actually made up of hair, nails, and the three layers, that is epidermis, dermis, and the subcutaneous. So when you come to the surgery section in the CPT book, the first page, you will see the index where you have a skin subsection illustration, and then all the headings and subheadings where all the procedures are grouped together. The first one is the FNA. You have a guideline instruction which is given there, the page. Code range for FNA is fine needle aspiration biopsy is 10004 to 10021. You have separate code sets for biopsy with image guidance and biopsy without image guidance. And you have a parenthetical note for percutaneous needle biopsy other than fine needle aspiration. See code range 190812 to 19086 for breast, 20206 for muscle, 32400 for pleural biopsy, 32408 for lung biopsy or mediastinal biopsy, 42400 for salivary gland biopsy, 47000 for liver biopsy, 48102 for pancreas. So other than the fine needle aspiration, you can go to this code range. So make sure you read this parenthetical instructions and understand it clearly. You also have something called the core needle biopsy, fine needle and core needle biopsy. So core needle biopsy involves a larger bore needle. A core needle biopsy uses a needle to acquire a tissue sample which is sent to histopathology. So this differs from the aspiration, that is FNA, during which a fluid sample is obtained and sent to cytology. When a core needle biopsy is performed, both the surgical code based on the anatomical site and a corresponding guidance code are assigned. The surgical codes for core biopsy procedures are assigned one time per lesion. It is not appropriate to assign a core biopsy code multiple times for multiple passes of the same lesion. Guidance codes are reported one time per session. Core needle biopsies are also known as percutaneous needle biopsies. Next topic is debridement. Okay. So under fine needle aspiration biopsy, remember you have codes from 10021 to 10012. Okay. And core needle biopsy, the code range is 20206 to 20220. So this differs according to the anatomy. 20206 is actually biopsy of the muscle using a percutaneous needle. 20220 is biopsy of the bone, trocar or needle, superficial, that is example ilium, sternum, spinous process, ribs. Okay. So depending on the anatomic location, you will be picking the core needle biopsy codes. And for that you can use biopsy guidance, radiological supervision and interpretation 76942, that is ultrasonic guidance for needle placement. If it is fluoroscopic guidance, you have to use 77002. It's an add-on code. If it is CT guidance, 77012 for needle placement. 77021 is for MRI guidance. Okay. Coming to debridement, here depth matters. Debridement is the removal of the necrotic tissue, exudate, bacteria, and metabolic waste from a wound in order to improve or facilitate the healing process. So the definition is given there in the book. Code range is 11042 to 11047. Wound debridements codes are reported by the depth of the tissue that is removed and by surface area of the wound. These services may be reported for injuries, infections, wounds, and chronic ulcers. When performing debridement of a single wound, report the depth using the deepest level of the tissue removed. In multiple wounds, sum the uh, different lengths together if it is the same depth. Wound care debridement codes are 11042 to 11047. That is the code range. Use these codes when the only procedure performed is wound debridement. 11042 is debridement subcutaneous tissue, that is the depth. So this already includes the epidermis and dermis if performed first 20 square centimeter or lesser. You have an add-on code 11045 is for each additional 20 square centimeter or part thereof. This add-on code 11045 should be listed separately in addition to the code for primary procedure. And what is or part thereof? That is 20 square centimeter or part thereof. You can split up 20 square centimeter. It should not mean that the surgeon has to meet the 20 square centimeter. Any part like 5 centimeter, like 11042 is for only the first 20 square centimeter. If the depth is like 25, so the extra 5 centimeters left out, right? So that will be coded using 11045. 11043 is debridement muscle and of fascia, that is which includes the epidermis, dermis and subcutaneous tissue if performed first 20 square centimeter or less. You have add-on code 11046 each additional 20 square centimeter. Then you have 11044 debridement of the bone includes epidermis, dermis, subcutaneous tissue, muscle and or fascia if performed first 20 square centimeter or less, and add-on code 11047. So these codes are defined by depth and size, not the anatomic site. So the documentation guidelines for these codes are, these are CPT wound care debridement codes. When a single wound has multiple depths, report one code based on the deepest level. When multiple wounds have the same depth, add together total square centimeters and report one code. For multiple wounds of different depths, report the deepest first and report the additional debridement codes with modifier 59. Code selecting is not based on anatomic location. So there are also codes for debridement that includes bone, but these are not in this section. So here you can see the different depths to which the debridement can be done. It can be done only to the epidermis, or it can go down to the level of the dermis, or go to the subcutaneous tissue. So when performing debridement of a single wound, report depth using the deepest level of tissue removed. In multiple wounds, sum the surface area of those wounds that are at the same depth but do not combine sums from different depths. So this is a coding tip for you. And there are some examples also given there in the book. Make sure you read it. So depth of the penetration of the debridement is very important. And also note the square centimeter for each code, as there is a restriction of how many square centimeter you may report with each code. So now let's test your understanding. Bone is debrided from a 4 square centimeter heel ulcer and a 10 square centimeter ischial ulcer. What is the correct CPT code? So the depth is same, bone. Okay. If it is heel ulcer, the depth is bone. If it is ischial ulcer also, the depth is up to the bone. So you can sum up the length. 10 plus 4 is 14. So the correct code, CPT code, you should have picked is 11044. So even though there are two separate wounds on different parts of the body, one on the heel and other on the lower butt, only one code is used because the wounds are both at the depth of the bone. Look in the CPT index under debridement and then bone, and you're directed to 11044. The code is for 20 square centimeter or less of debridement, so there are no add-on codes required. Next topic is repairs. Repair of wounds, lacerations, also known as closure. The CPT manual classifies the laceration repair codes according to three components: the length of the laceration, the complexity of the repair, either it should be a single or multi-layered, and the anatomic location of the laceration. Where is the laceration located on the body? Based on that, you will be picking the correct CPT code. What are the three types of closure? You have simple, intermediate, and complex closures available. Simple CPT codes are 120012, 12021 for simple closures done. A simple wound repair code is used when the wound is superficial, primarily involving the epidermis, dermis, or subcutaneous tissues without significant involvement of deeper structures where only one layer of closure is used, including for suture, staple, tissue, adhesive, or other closure. So these include only local anesthesia. Additionally, these codes can be used if chemical and or electrocauterization is used for wounds not closed. Simple lacerations are defined by two anatomic location groupings as below. So here anatomic grouping is present. 120012 to 12007, you have simple repair to the scalp, neck, axilla, external genitalia, trunk and or extremities including hands and feet. 1201 to 12018, simple repair to face, ears, eyelids, nose, lips and or mucous membranes. So regardless of location, simple repairs using only tissue adhesive are reported to Medicare with the code G0168, which is an ICPICS code. Report 120XX codes for non-Medicare payers. Coming to intermediate closure, the code range is 120312, 12057. An intermediate wound repair code would be used for wounds that require layered closure of one or more of the deeper layers of the subcutaneous tissue and superficial non-muscle fascia in addition to the skin. Skin is epidermal and dermal closure. So it includes limited undermining defined as a distance less than the maximum width of the defect measured perpendicular to the closure line along at least one entire edge of the defect. Single layer closure of heavily contaminated wounds require extensive cleaning or removal of the particulate matter also constitutes intermediate repair. So that is the difference between simple and intermediate, where you have layered closure and intermediate. For intermediate layered wound repairs that require extensive debridement, the debridement code would be identified in addition to the repair. Intermediate lacerations are defined by three anatomic location groupings as below. 12031 to 12037 is for intermediate repair to the scalp, axilla, trunk and or extremities including hands and feet. 12041 to 12047 intermediate repair to the neck, hands, feet and or external genitalia. 12051 to 12057 is intermediate repair to face, ears, eyelids, nose, lips and or mucous membranes. So be very careful with the anatomic groupings. The last one is complex closure. Code range is 131002 to 13160. A complex wound repair code would be used for repairs that, in addition to the requirements for intermediate repair, require at least one of the following: exposure of bone, cartilage, tendon or named neurovascular structure. Debridement of wound edges. Example, traumatic lacerations or avulsions, extensive undermining defined as a distance greater than or equal to the maximum width of the defect, measured perpendicular to the closure line along at least one entire edge of the defect. Involvement of free margins of helical rim, vermilion border or nostril rim, placement of retention sutures. So all these fall under the complex closures. So necessary preparation includes creation of a limited defect for repairs or the debridement of complicated lacerations or avulsions. Complex lacerations are defined by four anatomic location groupings. 13100 to 13102 is complex repair to the trunk. 13120 to 13122 is complex repair to scalp, arms and legs and or legs. Okay. 13131 to 13133 is complex repair to forehead, cheeks, chin, mouth, neck, axilla, genitalia, hands and or feet. 13151 to 13153 is complex repair to the eyelids, nose, ears and or lips. So within each of these groups, based on complexity, are codes specific to the size of the wound. For example, a simple wound repair to the scalp, neck, axilla, external genitalia, trunk and or extremities, including hands and feet, would use the following codes based on the size of the wound. 12001, which is for laceration which is lesser than 2.5 centimeter. 12002 is for 2.6 to 7.5 centimeter. 12004 is 7.6 centimeter to 12.5 centimeter. So all these are simple wound repair codes. So this is I hope that the difference between simple repair of a wound, intermediate repair of a wound and a complex repair of a wound is clear now. Simple repair is used when the wound is superficial. It involves only the epidermis or dermis or subcutaneous tissues without significant involvement of any of the deeper structures like muscle or bone. It will require only one layer closure. Hemostasis and local or topical anesthesia when performed are not reported separately. That is also included. That is simple repair for you. What is intermediate repair? This includes the repair of wounds that, in addition to the above, required layered closure of one or more of the deeper layers of the subcutaneous tissue, and superficial, that is non-muscle fascia, in addition to the skin, epidermal and dermal closure. It includes limited undermining that is defined as the distance less than the maximum width of the defect measured perpendicular to the closure line along at least one entire edge of the defect. Single layer closure of heavily contaminated wounds that have required extensive cleaning or removal of particulate matter also constitutes intermediate repair. And complex repair includes the repair of wounds requiring more than layered closure that, in addition to the requirements for intermediate repair, require at least one of the following: exposure of bone, scar revision cartilage, tendon, or named neurovascular structure. Debridement of wound edges, example, traumatic lacerations or avulsions. Extensive undermining, that is defined as distance greater than or equal to the maximum width of the defect measured perpendicular to the closure line along at least one entire edge of the defect. Involvement of free margins of the helical rims, um, as in the vermilion border or nostril rim, placement of retention sutures. Necessary preparation includes creation of a limited defect for repairs or the debridement of complicated lacerations or avulsions. Remember, complex repair does not include the excision of the benign lesions or malignant lesions. For benign lesions, the code range is 11400 to 11446. For malignant lesion, excision repair is 11600 to 11646. Okay, excisional preparation of a wound bed 15002 to 15005 or debridement of open fracture or open dislocation. All these procedures done do not fall under complex repair. So let us check another case scenario. Patient presents to the emergency department with multiple lacerations due to a knife fight at the local bar. After examination, it was determined these lacerations could be closed using local anesthesia. The areas were prepped and draped in the usual sterile fashion. The surgeon documented the following closures: 7.6 cm simple closure of the right forearm, 5.7 cm intermediate closure of the upper right arm, 4.7 centimeter complex closure of the right neck, 10.3 centimeter intermediate closure of the upper chest. So you have four choices which is given here. You can check it out. So first thing which you should notice, there are three types of repairs which are done here. See the length of the repair. And what are the different types of repairs? Here you have simple, intermediate, and complex also. You have to report the complex repair first, okay, followed by the intermediate and then the simple. So 7.6 centimeter simple closure of the right forearm, that is one code. 5.7 centimeter intermediate closure of the right upper arm, 4.7 centimeter complex closure of the right neck, 10.3 centimeter intermediate closure of the upper chest, which is the trunk. So two intermediate closures are there, so you can add up 5.7 and 10.3, which is 16 centimeter. Totally you will have three codes now. So which is the correct code? A option A is correct. 13132, 12035 59 modifier is added, and 12004 59 modifier is added. Okay. So sum of lengths of repairs for each group of anatomic sites. For example, what is sum of lengths of repairs for each group of anatomic sites? So uh, two wounds, but they belong to the same anatomic site. Then you can sum the length of the wound. So here the 12001, for example, simple repair of superficial wounds of the scalp, neck, axillary, external genitalia, trunk, and or extremities, including the hands and feet. 2.5 centimeter or less. So this is the that marking in yellow shows you the anatomic grouping. So simple repair codes have increased now. New codes have been added. So it is like 120012, 12021. All belong to our simple repair. Intermediate repair codes are 120312, 12055. Okay, so hope this video was very useful for you. uh, if you have any doubts, feel free to contact Codemy Medical Coding Training for more detailed explanations and any doubts regarding medical coding. Also, feel free to call us up on the number displayed. Thank you.